Officially, hello everyone. Thank you for joining. My name is Dr. Kathy Kyle, and I'm speaking to you today from the traditional territories of Treaty 7 land in southern Alberta, where I am honored to live, work, and play. I am a member and current chair of the CVMA Wellness Advisory Group and the leading force behind the Merck Animal Health CVMA It's Time to Talk About Mental Health in VetMed Awareness campaign. And today's webinar is in honor of the campaign. I also work for Merck as a regional services veterinarian in Western Canada. I will be your MC today. The webinar today is also in recognition of the Canadian Mental Health Association Mental Health Awareness Week. And the hashtag this time around is #MyStory, which aligns perfectly to today's webinar. The topic being, it's time to talk about trauma in veterinary medicine, build awareness, create connection, and inspire hope. Before I introduce our guest speaker, a warning that the concept of trauma is discussed in this webinar, which may bring up difficult emotions and trigger challenging experiences for some people. No specific traumatic event will be discussed. We have a number of safety resources available to you today on the webinar. First, we're so honored to have Dr. Reza Hijazi available as a safety support resource for one-on-one chat during the webinar. Reza is a member of the Wellness Advisory Group and also has a number of certifications in mental health, including being the only veterinarian in Canada certified by the Canadian Mental Health Association to teach mental health first aid. And if you're feeling impacted by the talk today or struggling, please reach out to Reza in the chat. Reza will also provide his phone number in the chat, because afterwards you may feel the need to reach out. And if that's the case, consider when you need to reach out and who you'll be reaching out to. There's also a number of safety resources on the slide, and I will place those in the chat shortly. So if you are struggling, or if you know someone who may be impacted by the topic of trauma, please consider reaching out together to one of these safety resources. Our speaker, Dr. Leann Benedetti, is also trained in trauma-informed coaching and will be available after the webinar to connect. Her contact information will be shared several times in the webinar today. With that, I have the absolute honor of introducing Leann, who I appreciate having in my life as an insightful, caring friend, a wise scholar on veterinary well-being, and a courageous and candid storyteller on her journey to recovery through a lived experience of trauma as a veterinary professional. Dr. Leann Benedetti has a number of certifications along with being a veterinarian. Leann is also a trauma-informed certified coach, an associated certificate coach, and has her certification in compassion fatigue professionalism. Dr. Leann Benedetti provides innovative, personalized solutions for the human beings of veterinary medicine as the veterinary coach, which she founded in 2017. As past practice owner and veterinarian of 27 years with clinical experience, she understands the challenges that our veterinary colleagues face, and her goal is to support the emotional and mental health of veterinary individuals, teams, and organizations. Dr. Benedetti has the benefit of lived experience combined with certifications, as I mentioned, and specialized training in compassion fatigue and burnout, and embodies the philosophy of trauma-informed coaching and trauma-informed practice. Bringing forward this wisdom gained, combined with her certified coach training, she supports and collaborates with veterinary professionals and organizations to co-create resilient, agile, positive, psychologically safe veterinary cultures. As one of the first and very few veterinarians who are ICF certified professional coaches in Canada, Leann brings a unique perspective and strengths-based approach to her work as a coach, mentor, educator, safe circle facilitator, public speaker, and advocate for veterinary well-being and wholehearted living. Dr. Benedetti is a member of the Canadian Veterinary Medical Association Wellness Advisory Group, a peer advisor for the College of Veterinarians of Ontario, and is an active part of the Veterinary Visionaries Working Group. Leann is also a mother, daughter, life partner, community member, and pet parent to Foxy, a special wee 3-kilo canine friend from the north. With that, Leann, welcome. Thank you for being here.
Thank you, Kathy. And it is an honor to be here today And I'm going to be honest, a little nerve-wracking. This is a bit different than any of the presentations that I have given so far in this leg of my journey. And so I am really grateful to everyone that's here, and have a couple of things to kind of set some intentions along the way before we really get started. First of all, I want to point out that I am aware that there is an internal landscape going on for me, as well as an external landscape going on out there in the world. And I feel like they have collided in the last 3 months, and they stand in the power of 3, as outlined on the slide. Internally, it's about healing, it's about passion, it's about purpose, and the power of intentional choice. And externally, we've just celebrated World Veterinary Day, Canadian Mental Health Week this week, International Coaching Week this week. What better way to combine all of my passions? And the fact that we are here on a full moon with a lunar eclipse and Mercury in retrograde probably is contributing to the energy that I'm feeling, which is really energized about talking about trauma in veterinary medicine, trauma-informed coaching, and using my story to give you some insight into what that looks like for me, with full recognition that this might not and probably is not going to be what it looks like for you, and your story matters. I am a human being, which I have always put at the top because I have to remind myself of that. It's easy for me to fall back into my superhero ways of being in full veterinary practice from my days in the past. I am a veterinarian. I am also a certified coach. I am absolutely 100% not trained at any level in psychology, psychiatry, social work, or any professional mental health field. I do have a lot of extra certification that I felt was needed from a place of integrity so that I could make sense of all of this for myself. And so, busy slide, I'm going to walk us through it because it's really important. I want to be clear about what this session is not. It's not HR advice, it's not legal advice, it's not medical advice, or giving you a diagnosis of how trauma has impacted your life in any way, shape, or form. I want to be really clear what that means. If at some point you think to yourself before, during, or after that I am telling you to do something or challenging something that you are already doing or know to be true for you medically or psychologically, that is not my intention. That is not what I'm trying to do. So please, for my safety, I need to know that you're going to stay curious and you're going to ask me if what meaning you're making is true. This is also not an attempt to name, blame, or judge anyone or anything. I have put in place a mindset of a no blame model. And this session is very much about sharing of information from me to you as a human being with lived experience that I have spent now the last 8 years trying to figure out, the first 53 years of my journey. It is a culmination of tools and evidence from the field of coaching, trauma-informed coaching, trauma in general, mostly from the work of Gabor Mate, and the polyvagal theory, which is the work of Stephen Porges. This is also me literally working well over 50 learned skills from the last 4 years-ish of therapy using the models of DBT, RODBT, CPT, and CBT. And those stand for dialectical behavior therapy, radically open dialectical behavior therapy, cognitive processing therapy, and cognitive behavioral therapy. And I'm here to tell you that these skills allow me to flourish forward. Mostly, this is a way for us to connect and create support in an industry that has not been very good at doing that for each other with each other. And I honor our ability to do that. I want to invite you to take the position of neutral, curious observer. All of what I say today, I'm offering with no attachment and no importance that you believe me or take what I'm saying to heart or into your brain. So I want you to have full permission to get up, walk away, turn off your sound, turn me off, take care of yourself, do whatever you need to do to stay safe in the moment and utilize Reza, who's here with us today, and the resources that you saw on the safety screen already. I also want to acknowledge that this really does feel like stepping out onto the skinny branches. And that actually, I was first introduced to that by a Toastmaster. I'm also a Toastmaster, learning to try and do this a little bit better. And one of my mentors says that routinely. If you step out onto the skinny branches, absolutely, the branch might break. And you might be surprised to learn that you can fly. So that is actually what I'm doing right now. And I know you can do it too. So this little slide is meant to give you an insight into what I understand about myself at this point. What I now understand, which is a very new understanding for me as my social location, is that I am white. I am second generation Canadian. I identify as female. My pronouns are she, her. I am 53 years old until tomorrow. I am an only child of two parents that were together for my entire life. And I am definitely coming from a position of privilege. I was described and remember being painfully shy when I was a little girl, quiet, smart, perfectionistic from kindergarten. I had very few friends. The friends that I did have were very good friends. I was taught that manners and etiquette matter most, and good girls are seen and not heard. I was on the honor roll, and generally throughout my lifetime, I've been considered a thinker. I remember wanting to be a veterinarian since I was very little. I'm going with 6, 7, or 8. And to that end, I started working in a veterinary clinic in grade 9. I don't know how old I was. Interesting thing about trauma, it affects our timeline sometimes. I went to the University of Guelph from 1988 to 1992 and got into vet school in 1992 and not 1996 graduated as an OVC Lynx. In my final year of my Bachelor of Science in Toxicology, I did my first year of pre-vet combined, which meant 13 courses, which sets the stage for what you're going to hear next and what is familiar to many of us veterinary folks as high achievers and perfectionistic tendencies. Once I graduated, I stepped out into mixed animal practice, was there for 1.5 years-ish, went into small animal practice as an associate veterinarian. In that time, I got married. I had 2 beautiful children. I then, in 2004, decided to narrow my focus to mobile practice only. And I founded Georgian Bay Veterinary Hospital, or Georgian Bay Veterinary Mobile Services. In 2010, I built a hospital. I built and designed a hospital to support the clientele of that mobile practice because it grew so fast. And all of a sudden, I was a practice owner. I was a team leader. I had a growing number of clients, a growing amount of responsibility, a high call to service. I was one of those folks that rarely said no. I definitely charged under the fee guide, and I thought I was justified, and say I was justified because everything that I did was in service to my clients and my patients, probably at the expense of myself. I gave us a presentation in 2018, which I went back to gather information on the timeline of this to the first year students. And I'm going to read you what I wrote because it still stands true today. On a good day, when I say I'm a veterinarian, I think of myself as a superhero, a lifesaver, a champion of all those that are vulnerable, a disease preventer, a servant leader, a magician, a problem solver, a relationship builder, and an important community member. Truly, I believe I am a member of the most noble profession on earth. On a good day, saying I'm a veterinarian makes me feel proud, inspired, passionate, connected, smart, worthy, trusted, authentic, and respected. On a bad day, I don't like to say I'm a veterinarian because I think of myself as a traumatized warrior, a doctor of death, a failure at every turn to everyone, an imposter of a healer, and that no matter what I do, I am never good enough. On a bad day, I say that saying that I am a veterinarian makes me feel embarrassed, exhausted, ashamed, vulnerable, and alone. What I did at that time was also lay this out in a timeline for folks to see it a little bit better. The red line is the place where I originally made that timeline from. Later, a few years later, I came to learn that that actually is part of the compassion fatigue training and compassion fatigue recovery, is to create your timeline of events and get an awareness of how you got where you got. And this is my timeline. And it started as I graduated out into practice. There were a few successes. There was a lot of stuff I experienced along the way. There was a lot of things, a lot of people, a lot of stuff, a lot of shit in my words. And when I opened the mobile practice, my kids were 2 and 4, and I thought I was doing that on a part-time basis so that I could stay with them and be with them and have some semblance of a life for them. It grew so quickly, and I built the practice in 2010. And from that time forward, it looks a bit like a patchwork quilt, because in 2013, my associate went on maternity leave. I tried to create some patchwork quilt while I still ran the mobile in a semi-full-time way and tried to man the practice as well, because I thought I could. And I actually felt like I had it all under control. And to some extent, I did actually, for everyone else, my clients and the practice, but certainly not for myself. For me, it was work, work, and more work. In 2013, I do remember thinking that there has got to be more to life than this. And in 2015, the big star in that timeline is the day that I collapsed when I walked into my clinic. There was a series of small events that led up to that, none that would indicate that that would happen. My receptionist literally looked at me as I was walking in the door with some bags in my hand and said, "Are you okay?" And in that moment, I realized I was not. And down I went. And 911, ambulance, hospital visits, all kinds of medical procedures, ride down to the heart center, cardiac center in Newmarket, which is an hour and a half away, full cardiac workup as an emergency because everyone thought I had a heart attack. And at the end of the day, I had not. I was discharged saying, "Your heart is fine, see you later, bye." And I said, well, if my heart is fine, what just happened? And literally, I have spent the last 8 years trying to figure that out, because to me, it needed to make sense. And nothing that I came across and nothing that I experienced and nothing that I heard from those that from those opinions that I knew to reach and seek out gave me an answer that made sense. This last little bit of the timeline from 2015 and that red line and June 2019 represents a couple of my starting of coaching, and my movement from practice out as the veterinary coach is the purple star. There was a pretty impressive traumatic event that happened in 2019. You'll notice it's a smaller star. And it's smaller because I had already engaged help by the time that event happened. And even though it was one of the most impactful things to me in my life in the moment, because I had support engaged and I was already on this journey, there, to me, is very little residual effect to that. I was the victim of a cyber crime, and it pretty well affected my entire life. And that was the point in time when I realized that I was considering suicide. And that is not a part of any of the rest of this conversation. The rest is all about from time 0 to June 9th, 2015, because that's what I've spent the time figuring out. And the interesting fact that goes along with that is if we experience a traumatic event or understand that we have, and we get help within 3 months, we are significantly less likely to have it be impactful and carry it forward with us and have it turn into a layer of complex trauma or a chronic trauma situation that continues to move forward with us. In my journey, these are the 2 graphic representations of what you'll see happening. I started out in mixed animal practice. I went to small animal practice. I went to mobile practice. And then I had a series of events that led to my ultimate physical collapse. That time period felt a lot like, mostly from 2008 to 2015, felt like trying to hammer a square peg into a round hole, and the pieces that come off as a result of that. In the end, that's what it felt like to me. That's the best graphic representation that I could possibly come up with to show you. I felt like, to the best of my ability that I could put into words, that I was broken. And in fact, that veterinary medicine had broken me. And I felt unseen, unheard, and misunderstood. And I was also pretty sure it was my fault. And that speaks to the heart of the problem, which was somehow I had convinced myself that this was my fault. And being discharged from the hospital, being told that I was good to go, my heart was fine, and left to pick up the pieces on my own, I had to look at things and say, well, what do I have at my disposal to pick up those pieces? I have a super strong call to duty and service, because to date I hadn't taken any time off, and now I had 6 weeks off to figure it out while I recovered. I have a beautiful, analytical, very linear brain that was very good at critical thinking and complex problem solving. I have a strong sense of integrity and a strong sense of the need for this to make sense. And I also had an intuitive knowing that this was bigger than me, and that this would all make sense one day at the right time. Fast forward to today. I also had at my disposal the tool called the Professional Quality of Life Scale. And there had been some talk by then, because compassion fatigue was kind of named as a thing in 1995 by Figley. And there had been talk about it and discussion about it, but I really didn't think it was about me, because the problem was not that I was tired of being compassionate. I don't think it's very well named. I don't think it really lands with us well. I don't think it sits well. It's not intuitive. We don't really understand it. So I just decided to cross it out, because that seemed to make the best sense to me. And I come to understand a little bit better now that the compassion piece fits in as who we are as caregivers. And that is unpacked in a different time and a different talk. However, nonetheless, this professional quality of life scale is a self-assessment that we can do that gives us some idea, as a clue, not as a diagnosis, but as a clue, what might be at play here. I was sure that I would score 100 out of 100 on the burnout scale. I did not. I scored low on the burnout scale. I actually scored decently on the satisfaction scale, because I still was getting rewarded by the work that I was actually doing. And I was doing a lot of it. I scored really high on the trauma scale, which was a double-edged sword, because trauma at the time back then was defined as secondary traumatic stress, which essentially was the piece around the stress we experience secondarily by being caregivers. So the concept of vicarious trauma, which was maybe true, and I needed to figure out more about that. And so, kind of armed with this clue, I went out into the world and I started talking to people. And it turns out that the people that I was talking to might be considered traumatizing systems, as I understand them now. That includes the medical system, who told me that I did not fit the bill for trauma because I had not experienced up to that point in time when I collapsed any event that threatened my life or that threatened the life of anyone close to me, human, of course. Mental health support, compassion fatigue is not a diagnosis in the DSM, even though we were talking about it and all of those things, and neither is secondary traumatic stress syndrome. So good luck with that. Private disability insurance doesn't necessarily cover you for a mental health condition, which is what compassion fatigue, if it actually is considered a thing, is considered. Public disability insurance here in Ontario does not cover one as a veterinarian without any other kind of recourse, because either you're at work paid or you're at work unpaid. Our academic institutions seem to be contributing to the situation. This has been going on for 20 years. And we're researching it, and we're researching it, and we're researching it, and not much has changed the needle on the well-being front. Our associations were telling us that actually the surveys showed that clients still loved us, whereas my experience was that it was getting more and more challenging dealing with their questions and their concerns and the information they were coming with, and the questions they were asking and the challenges they were presenting, that had shifted for me. And I was told that wasn't actually true, that the public still loves us and we still have their trust and support. And I felt like the well-being conversations that were going on, and this is a no blame model, I felt like my perception was, my story is that was a conversation that didn't apply to me, because it didn't capture my lived experience or the life that I had created for myself, buried in practice, working 7 days a week, 365 days a year, 24/7. Note I say I had created for myself, which is one of the pieces here. Nonetheless, all of those systems were telling me that I did not belong. My story did not belong in their framework. And I could not find any help that made sense. And so the only piece of information that I had didn't fit into any kind of bigger picture within the system. And while I had all these physical symptoms, which is a lot of them, actually, and this is probably isn't all of them, what I heard, or what the doctor heard, what the professionals heard was, oh, this is about you being sad, you're depressed. And this is about you being worried, having insomnia and GI symptoms that are consistent with IBS. That's anxiety. Good news, we have medication for that happens to treat anxiety and depression both. This is, again, I'm not trying to give any kind of advice or say that what anyone is doing is wrong or right. For me, that didn't make sense. It didn't make sense. It wasn't that I wasn't worth considering it. I was using my complex decision-making skills and my critical thinking and saying, it doesn't make sense to me. And so what I was hearing, what I was being told felt more like, you don't belong. Your story doesn't make sense. You're wrong and you're crazy. And at some point along the way, I decided to say, well, I guess I'm on my own to figure this out. Was I really? Probably not. However, that's the way it felt at the time. And so in the censored version, I said, it. And I started looking outside of veterinary practice and outside of the resources available to the veterinary practitioner. And I found the veterinary leadership experience and Dr. Betsy Charles, who came to speak in Collingwood here at an OVMA Great Ideas talk. And she talked about emotional intelligence, and she gave me the language of stuff that I had been trying to live and trying to breathe and trying to understand for decades. She gave me the language and she gave me the framework, and she gave me the onus to go to Idaho to the veterinary leadership experience. The bad news is I had to wait a year because the other one had just finished. When I went there a year later, veterinary, and I hung in there. I was like, yep, this is the answer. And I have diligence and perseverance as a strength. I am going to hang in here and I'm going to go. And veterinarians, when I got there were these veterinarians that were coaches. And I went, what the heck is that? And then I got introduced to a couple of them. And then I got introduced to a couple of certified ones that had actually gone through coach training. And then I decided, so would I, because I clearly have a lot to learn on this front that might be beneficial. And from that training came my business, The Veterinary Coach, because I understood early on, even though I didn't have it all figured out yet, that what I was seeing out there in the veterinary world was pretty similar, whether the story was the same or not. The feelings were pretty similar and things were getting worse. So purpose and passion shifted to try and help, trying to understand this on behalf of myself and on behalf of the profession too. And lo and behold, I learned about this inner self-processing system, otherwise known as the iceberg theory. This comes from my Adler coach training process. And I learned that we're icebergs as individuals. And I learned that every iceberg is unique, actually, and thinks and feels in different ways. Sounds silly. I didn't really understand that before. I mean, I saw it play out, but I didn't really understand why or how. And this model tells me how. It tells me that our state of being, our memories, our knowledge, our experiences, our beliefs, our mindset, our attitudes, our values, all contribute to our thoughts and feelings. And our thoughts and feelings are what drive our actions and behaviors. And our actions and behaviors are what drives our results, our impact, and our influence, for better or for worse, on ourselves and on other people. And, oh, by the way, all of those things are created by a whole bunch of factors and influenced by a whole bunch of factors, such as our personality traits, our genetics, our general temperament, which is, to speak to the emotional sensitivity of some folks as feelers, and how we feel into other people's emotions, and informs the language around being empathetic versus empathic and an empath, and a bunch of other psychosocial factors that contribute to all of this conversation. And I know it's bigger than that, and I understand that it's bigger than that, and it's probably bigger than that for you in so many different ways. It gets too big for me and unwieldy, and then I get stuck. So to me, that was enough to help things make sense. And getting to know that about yourself, those things about myself, could be really helpful. So I did. I also came to understand that the feedback loop that I had been experiencing for the last few decades, well, my life essentially, was not necessarily a good one on behalf of myself to myself. The narrative and the story that I was telling myself and thinking about myself was creating a negative feedback loop. And what I now realize is the goal, if I can fast forward for a moment, is that the goal here is when we get negative feedback from the outside world or ourselves, one of the things that we need to learn how to do is turn that into a positive story, or at least not a negative story, a neutral story at best. where we consider all the facts and we can open our hearts and our minds to other possibilities than the story we're telling ourselves in our head. Thank you, Brene Brown, for that one. And where I realized the power was the waterline. The waterline, oh, hold on a second. I got to click through things here. The waterline is the space. Thank you, Betsy Charles, who presented this to me at the Veterinary Leadership Experience, who ultimately is credited is Viktor Frankl, who gave us that between stimulus and response, there is a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom. What that led me back to is this professional quality of life conversation, because in my burnout, in my compassion fatigue training, one of the things that it said in there was that increased perceived demands, perceived being a keyword, and decreased perceived resources meant threat, perceived threat. In my language now, threat system activated. Sympathetic system activated. That means I want to either fight or flee or feign and stop in my tracks. And that's what happens when we perceive threat, we don't feel safe. So I'm laying the breadcrumbs for us here in the way that I figured this out for myself by myself back then. When we perceive threat, we are more at risk to try and control everything. And then what happens when we try to control everything with limited resources and increasing demands is we perceive more threat and we are more chronically stressed, and the feedback loop continues. So we have our professional quality of life as veterinarians. We have the fatigue that happens because of burnout and secondary traumatic stress, which can be translated into threat system activated. And we have compassion satisfaction, which is the good things about our job and the good things about our work, which, let's be honest, our negativity bias focuses in a different direction. And then when we started the well-being conversation and started talking about what is wellness and what is well-being, Dr. Debbie Stone has written about this in the Canadian Veterinary Journal. We have this concept of wellness in 8 dimensions, which is this beautifully balanced, nice circle, which is in keeping with my beautifully balanced original logo of what balance is, which is that this is a nice circle and we have to pay attention to all of these things. What that led me to be is like, well, what do I think about veterinary medicine? What does my life look like if I was to change this graph around? And that's the version on the right. My work had taken over my world. My work had taken over all the rest of the dimensions of being so that you could barely see them anymore. And by the way, there was this big red elephant at the back of the room. That was the emotional piece. And in the coaching world, that also represents the wheel of life, which is what we use as a tool to assess our happiness in these different dimensions and direct energy towards areas to focus on in our life. Well, if we can't see any other areas, it's pretty hard to direct time, attention, and energy there. And at some point, that big red elephant at the back of the room comes to the front of the room. And so in 2019, early 2019, I decided that I was going to go back to something I had heard in the beginning, which was you have to figure out what brings you joy and find more of it, and what drags you down and do less of it. So I decided I couldn't do anything about the what drags me down piece. So I decided to, okay, I'll go find joy. So I engaged a therapist. And I was sitting in the group DBT, dialectical behavior therapy room, with a group of 8 or 9 people. And all of those 8 or 9 people were talking about how their emotions got in their way all day and swept them away so that they couldn't think clearly, and all of these other things that I didn't understand. And I was sitting there thinking to myself, okay, here we go again. I'm crazy. I don't belong, blah, 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 all that stuff. And then the gentleman next to me spoke up. And he said, I don't have time to feel any of those feelings. And so I just keep stuffing them down and away. And then I finished his sentence. And I said, and at some point that storage becomes full, doesn't it? And we shared a connection. And he was a police officer and he was a first responder. And a connection was made there too. And I realized in that moment that it felt like I was frozen and had spent a lifetime, I'll remind you at this point, of the painfully shy little girl who at some point decided that it was better to stuff all those feelings down and not feel them and not show them because that didn't feel safe. That little girl started that process 40 some odd years ago. And it was reinforced by my parents, and it was reinforced by my school, and it was reinforced by being selected into vet school, and it was reinforced by that whole establishment of work ethic and the way we know it to be true. And I'm not going to elaborate on that. And this is a no blame model. And so I stand in choice. And so if I accept that I'm frozen, then I guess I better figure out how to unfreeze, which took me to the polyvagal theory. And I see that we're getting kind of close to end of time, so I'm going to go through this fairly quickly because there's a ton of resources otherwise next. And our next speaker, I think Erin Wasson, is going to talk more about this. But this took me to the polyvagal theory, which essentially outlines that our nervous system state, so now this is about my nervous system, this nervous system state that is engaged defines how we experience ourselves, how we perceive ourselves, how we experience others and the world around us, how we perceive them and the world, what we are able to think and feel, and what behaviors and actions we actually have available to us in those different states. The model in its most basic form says this: safety and connection exists in the green, over there in the compassion, satisfaction category. Sympathetic, which is when we are mobilized, when we feel stress coming on, is that fight or flight space. Freeze is actually a hypermobilized state in our nervous system that is a result of being chronically sympathetically dominated. And at some point, chances are you're going to revert to a dorsal vagal state if you are apt to do that at some point in time and get stuck there, which is when you collapse and you walk into your clinic one day. And suddenly a bunch of shit made sense. Because these states represent everything that I had been thinking about. And it made sense from this graphic, and it made sense to by the way, the image that I had chosen for the veterinary coach to be its photo, which is this, what looks like beautiful, magic, passive state of balance between a very light feather and a very heavy rock. Again, I maintained we have to keep this straight balance. And what it speaks to is that maintaining that safety and connection space where we can feel connected and where we can feel that satisfaction and where we have access to positive emotions is an active process. That's the self-care. That's engaging the parasympathetic system with purpose and intention. It's starting to make sense now. Now it's starting to make sense what they were telling me from up there that I didn't understand before because I couldn't hear them because of the state that my system was in, which is one of chronic stress and threat. Then what still didn't make sense was the trauma piece. And then Gabor Mackay came along into my life. And I listened to his Wisdom of Trauma movie, and I listened to it, what an 1.5 hour movie took 3 days to watch, because I literally stopped it and wrote down every word as I went along that stood out to me. And what stood out to me the most was his definition, because all of the conversation around trauma up until that moment in time had been around an event, a response to an event or multiple events. But there had to be some precipitating factor that was named as a big deal, as a star on the thing, that was associated with all this. And I did not understand or recognize or have any awareness that I had experienced any of those. And he asks us to define trauma a little differently. And it deepens what Dr. Phil Richmond asked us to think about in our last Time to Talk webinar. He asked us, in relation to substance use and misuse in veterinary medicine and healthcare providers, he asked us to think about the question, what happens if we change the question from what's wrong with you to what happened to you? In respect to the ACEs category, ACEs conversation and the Adverse Childhood Experiences Survey. And I'm asking us to take that one step further and ask not what's wrong with you or what happened to you, what happened inside you, and what meaning did you make of it along the way? What story did you tell yourself? What state were you in? And does it make sense? And all of a sudden, I got to use that trauma from the professional quality of life scale, the clue that I had gotten that made sense way back when. It was a frozen T at this point, capital T. And I learned how to find the joy and feel the fields, which actually dissolved the ice into this, all the little T's. And that's the way they're talked about out there in the literature, which doesn't necessarily feel respectful or right. And that's what I've got because I'm a work in progress so far. The concept of the little T is that the little T's are the micro traumas, the little moments where something gets hurt inside of us and is a wound that doesn't heal. And we carry around with us. And that is expanding the conversation of trauma in veterinary medicine at this point. That's the conversation that's going on. And the conversation from a trauma-informed care place at its highest or lowest level, whichever way you want to think about it, is that my experience and my journey was one of a narrowing of the window of tolerance. It was a funnel from I was pretty good and I narrowed in because I couldn't tolerate the things that were coming my way without doing something differently and avoiding what was happening and avoiding the situations that were causing me the most distress and stress, because that's what I had within my control with the skills and tools that I had at that time. The alternative would be to expand the range of resilience, because that's the other language of the same thing. Somatic Experiencing Institute is one, and is part of the Trauma Institute, which is part of this conversations and how we feel things in our body, which I'm now 8 years later just starting to understand that I can do, because our body keeps score. That's a book. Pin that. It's important. Not in this conversation. It's too big. But our choice becomes, we can believe that we need to increase resilience and keep the conversation just about that. And we might want to stop and think about what happened to narrow the window of tolerance in the first place and learn from that wisdom and flourish forward. And I wouldn't argue it's an either or an or, it's an and, which is one of the fundamental premises of dialectical behavior therapy. And when we can do that, that changes this little graphic and expands the trauma piece and expands the language that we can start putting into the box and the understanding that we have about it. But we have to do that because veterinary medicine is misunderstood, generally speaking. Most care providers, many care providers, don't understand all the things in this box and that we experience them and how we experience them. And so when we can put some language to this and put some framework to this, then we all of a sudden can advocate for ourselves for trauma-informed, veterinary-informed treatment options. If you actually go back to what Figley wrote in 1995, he wrote, compassion fatigue is identical to secondary traumatic stress disorder and is the equivalent of PTSD. 28 years later, we're getting closer to believing that is true. And we've expanded that knowledge base and understanding base tremendously. And I think we need a bit of a quantum leap, which is why I'm here today to share my story. So what are the takeaways? I offer us the metaphor, which turns out I really love, because I actually am a recovering feeler. I'm a deep, deep, deep feeler that I stuffed them away 40 some odd years ago and told myself I was a thinker. That was part of what happened inside of me. So I offer you the metaphor of a riptide. And it's a metaphor. And what it means is that there is an undercurrent in our occupation that is not yet defined and not well understood. And if you are experiencing it, if you have experienced it, you're not alone. And regardless of what your experience is, you're not alone. We are not alone. By the way, all of humanity is suffering or has suffered in one way or another in many different ways beyond the scope of this conversation, and which I am still working very hard to understand and embrace and embody and integrate into my understanding. I didn't figure this out alone, even though it sounds like I did. I resourced and I went and I learned and I was curious and I kept trying to make it make sense. And I didn't do it alone. I had a lot of people that walked with me. And you don't have to do it alone either. Uh-oh. I almost made it. There are a lot of resources out there, outside in the big world, as well as growing resources in the veterinary world. And what we need to understand in our veterinary workplace, what the true call to trauma-informed care is as an embodied thing from a wholehearted place, is that when we appear in an ocean somewhere, the people that are with us and around us have probably been picked up and been swept away by an undercurrent and have just popped up. And whether they've popped up in your life for a reason or a season, or have they been there for a lifetime, if we all understand that we're doing our best and we bring our past to the present, and it doesn't define how we move into the future, then that's where our opportunity for freedom and growth lies. And so I want to be very clear, as a trauma-informed coach, I am not the healer for you. I did my own inner work to heal on my own behalf, and I've shared with you what that looked like. Your story is your story. And trauma-informed coaching is positioned as post-traumatic growth. So once we understand it, once we're aware of it, once we are ready to let the past be the past and focus forward so we can flourish, I'm in. And if we're not there yet, I'm in, because what I can do is I can listen. I can honor your story. I can walk with you and I can connect you. And I can be there when you're ready to focus forward. And I'm not telling you to do anything that I haven't done. So I know you can do it because I did it too. And I believe you can. And I'm a work in progress. This is a work in progress. And I've just launched I am launching a new website. So if you go to my website, you will see under construction. And the best thing that you could possibly do right now is reach out to me directly through my email, which apparently is not on this slide, or my phone number by call or by text. My email is easy, Leann, Leann at theveterinarycoach.ca. And you can connect on my website. And I'm here to help. And I want to be, and I am pretty clear on how I can help and how I can't help, which is part of the training of the certified coaching and all of the other credentials that I have worked very hard to get. I may have forgotten to breathe, so I will invite us all to do so.
Deep breath in.
Wiggle some eyebrows.
That's what I learned at the CVMA with you, Leann, amongst many other things, is wiggling your eyebrows. Helps to shift where we're at.
It does. Stimulates the vagus nerve and the parasympathetic safety and connection system.
Lovely. Oh. Well, may I say a big thank you on behalf of everyone on the webinar for stepping out on your skinny branch and flying. And you flew. And your branch is bigger and thicker and stronger. And thank you for entrusting your story to us. It's important, it's valuable, it made sense. I can tell it made sense from the back and forth in the chat. And it hopefully was for you, and I don't know if cathartic is the right term yet. I hope it was as cathartic for you as it was powerfully inspirational to all of us. So with that, I thank you for popping up, Leann, and staying above the riptide. Thank you.
Thank you, Kathy. And what I'm aware of now, as I've come to the end of this leg of my journey, doesn't mean the healing is done. And it means that there is actually a path, which I didn't include, that is the post-traumatic growth journey and contribution and telling your story in a safe, hopefully safe way. Is kind of the end point of that journey. And so I'm grateful. Thank you.
Thank you. And your journey continues, and perhaps your journey will bring us back to having you in a future webinar, share a storytelling opportunity. We're coming up to the top of the hour, so we do have some questions in the chat. So I would invite, for people who do have questions, if we're not able to get to them, please contact Leann. Leann, I put Leann's email as well as Leann's website and phone number in the chat. Amazing kudos coming through. I do want to let people know that the next two webinars in our series, and not to fast forward through spring and summer, that is not my intent. They're excellent seasons. We do have Dr. Marie Holloway-Check coming up on September the 15th in recognition of World Suicide Prevention Day, and she'll be speaking on workplace response to suicide. And then on November 16th, we have Erin Wasson, who is a social worker at the Western College of Vet Med, bringing us back to the trauma piece with respect to nervous system dysregulation and the impact of being in the company of trauma and veterinary medicine. So with that, we've just got a few more minutes. So I will just go back to the one question that came through. Lots of gratitude. Perhaps there wasn't an actual question. Have you ever considered the spiritual healing perspective of it all? And I think that's to all of us, you know, considering that. What would be your comments to that, Leann?
Short answer is yes. That to me actually is the true concept of wholeness, which was my original like coaching veterinarians for wholeness. That fills out the fourth or fifth dimension of wholeness to me, that spiritual place of truly mind, body, spirit, healing and and feeling whole, which is feeling resourced, not just being resourceful, but feeling resourced and truly connected to something bigger, which is part of the process as well, is that, again, that intuitive knowing that this is about more than just me, and not really knowing what that is necessarily. I'm not a particularly religious person, but spiritually, I'm a very energetic person. So back to that empath piece and how this is all energy for me. That's the spiritual.
Thank you. Thank you for sharing. So we're a little bit after the hour. A reminder that this was recorded and the webinar will be posted at a particular link, which is going to be not password protected, but it will be available to members of the CVMA. Because this is a topic that includes someone's sharing of the story, thank you, Leann, we do want to be mindful of safety and security on that front. So with that, I wish all of you a wholehearted day. Be safe, be kind to yourself, and hope to see you back at our next webinar in September. I will stay on though if anyone does have questions, but at this point in time, we can stop the recording. I'll stay on just for a few more minutes. So I wish you all a beautiful, hopefully sunny day where you're at. Take care.